we're going to share with you just 3 quick hip mobilities that we use that we find are very helpful for our athletes and patients. So what Dave is going to do is he's going to lie supine on the ground. One leg is going to be straight in the air, so go ahead. And one leg is going to be bent. We're going to make sure he braces his core, presses his low back into the ground, and then he's going to abduct that leg. And as he does it, he'll get a nice little active stretch on his adductors, and at the same time he gets core stability. So it's core stability and hip mobility, and he'll come back in. And you'll notice that when he doesn't try to let any of his core or his hips move, he just lets that leg open up. So again, we call this supine leg swing. We find it's very good mobility for the hips, but also great for core stability. You can incorporate it into your warm-up or as an exercise. Okay, we call this exercise the seated wiper. And so what you're gonna have your patient or athlete do is sit on their butt with their feet out in front of them, knees bent, and then you're gonna have them drop this leg to the ground and rotate this femur down and turn their body. And then you're gonna have them keeping their feet in place, rotate back the other way. So his feet stay in place, and he rotates back the other way. So he's getting some hip external rotation and then some hip internal rotation. Go ahead and go again, Dave. And you want to make sure that when you drive this leg down, especially on the internal rotation, that the person is really moving at that hip or that femur rather than just torquing at the knee. If the athlete has enough hip mobility, they can do this without their hands down, or the patient has enough hip mobility, and what they'll find is you get a lot of core activation as well. So seated wipers, great for hip rotation and core activation. Okay, the last hip mobility that we have for you is called a pigeon. It's a very familiar exercise in yoga. We've just made it a little bit more dynamic, and we incorporate them into our warm-ups or as a mobility in between strength exercises. So you're gonna have the patient or athlete get in a push-up position, and then Dave's gonna take his leg up towards his chest, rotate it, and sink and get a good stretch on his glute and a little bit on his hamstring. He's gonna switch sides. Really important that he tries to keep his hips square. The more that he can get his tibia perpendicular to his torso, he'll probably feel a greater stretch. If you notice that somebody's a little bit tighter, they might not be able to get that tibia as far out or as perpendicular. Again, the pigeon, great for opening up the posterior hip.